Hi everyone, I am CJ Sele and today I will be going to tackle with you about proper hand hygiene. Okay, we will start by stating our specific objectives. At the end of the 10-minute discussion on proper hand hygiene, the students will be able to first to have an overview knowledge about proper hand hygiene and its relevance. We will be going to know its relevance, its importance, on why we should do proper hand hygiene. Then, next is to identify the critical times when we will be going to use or to perform hand washing, when it should be performed. Then, next we will be going to demonstrate the correct steps of proper hand hygiene using soap and water. Then lastly, we'll be going to analyze and identify common mistakes in hand hygiene practices. Later on, we'll be going to know those practices that we commonly or nakasanayan na natin. We will be going to know if it is a mistake or not. Okay, we will now start. For the overview of proper hand hygiene, we will be going to know the definition and its importance, the role in infection control, and the link to patient safety. Okay, for the definition, proper hand hygiene refers to the act of cleaning one's hands thoroughly using soap and water or thoroughly using an alcohol-based hand rub to remove dirt, germs, and other contaminants. It is one of the most effective ways to prevent the spread of infections. Now, its importance: hands are the main pathways of germ transmission in healthcare. Do you all agree? Yes, because we are touching everything and everyday life. That is why regular and correct hand washing significantly reduces the presence of pathogens. The rationale for this is that we should do proper hand hygiene or proper hand washing because it reduces the spread of microorganisms. That being said, we can help break the chain of infection. Now, speaking of which, here we have the role in infection control. Hand hygiene plays a critical role in infection prevention and control in all healthcare settings because it helps, first, break the chain of infection between contaminated surfaces, healthcare workers, and the patients. The main rationale of this is that if we frequently practice proper hand hygiene, it reduces the spread of microorganisms. With that being said, we can prevent we can help break the chain of infection. That being said, hindi na siya ma-transmit pa sa iba. Okay? Next, it prevents the transmission of healthcare associated infections or HAIs such as the MRSA. Are you familiar with that? The Clostridium difficile and the norovirus. Next, it reduces the risk of antimicrobial resistance by preventing infections that may otherwise require antibiotic treatment. Now, linked to patient safety. Hand hygiene is a key component of patient safety initiatives because it reduces the risk of patients acquiring infections during their hospital stay. Next, it enhances patients' trust in healthcare providers who follow proper hand hygiene protocols because who would trust a healthcare professional who are unhygienic? They will be supposed to be the role models. Now, next, it supports a safety culture by promoting responsibility and accountability among healthcare professionals. Now, let us proceed to the critical times when it should be performed or when it should be done. Okay, it should be done, or the proper hand hygiene or proper hand washing should be done before eating or preparing food. Before touching your face, your eyes, your nose, and your mouth, we should wash our hands first because our hands touches everything, right? Next, treating a wound, or caring for someone who is sick. Then, we should perform hand hygiene before starting a sterile or clean procedure in healthcare settings. Next, after using the toilet, after blowing your nose, coughing or sneezing, we should wash our hands. After touching the garbage or throwing a garbage, after handling animal waste or pets, we should, of course, proper hand hygiene. Then, after changing diapers or cleaning up a child. Then, lastly, after touching blood, bodily fluids, or contaminated items. Now, in healthcare settings, before and after patient contact, we should proper hand hygiene. Before aseptic procedures, such as inserting catheter, because that is sterile, and it could lead to potentially further complications. After contact with potentially infectious material. Then lastly, after contact with the patient's environment. After doing that, we should wash our hands. Now, we will proceed to the steps and techniques of proper hand hygiene. That was given by World Health Organization 7-step method. Now, I will be going to show you a video. Let's watch this.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
So, that's it. Now, I know you learned the steps and techniques on how to do the proper hand hygiene. Now let us address, or let us know, those common mistakes that we usually do, and we are what do you call that one? And we are unaware that it is a common mistake or simply inappropriate. That is why we are addressing it now. First is not washing hands long enough. It should you wash your hands for at least 1 minute after you sing, or after you sing happy birthday twice, right? Then skipping key areas such as not washing thoroughly, including the area here, and all. Then using water only without soap. Are you guilty? Then not drying hands properly. Then touching contaminated surfaces after washing. After you wash your hands, for example, after you wash your hands, then you touch the doorknob without cleansing, or without cleaning the doorknob. That is one of the common mistakes, because it will be useless, right? Then wearing jewelry or long nails. The rationale for this is that the microorganisms might mukapyot siya sa jewelry, or musulod sa nails, which is lisod siya makuha. And then mahitabo murag walay sense or wala ra siya, useless ra ang mga pag wash of sa mga hands. Then lastly, using alcohol-based hand rub when hands are visibly dirty. It is advisable to only use alcohol-based if your hands are not visibly soiled. If dili kayo siya hugaw, kanang wala kayo siya mga residues or saba, we should practice the soap and water because ma-cleanse siya og tarong, makuha gyud siya og tarong. Okay, that would be all. Thank you for your patience. Thank you for your listening. Bye bye.